most of these slides were exceptional, just for experts a little bit. I have no idea who is dealing with skin lesions, ulcers, burns, and all this stuff. Okay, some do. This is a large field, which will become in the market within the next 1 or 2 years. You've seen the picture, and you can see the picture and all these exceptional indications on the ISMSD website. Osteochondritis dissecans, Osgood-Schlatter, Peyronie's disease, spasticities. Peyronie's disease I've been in Asia for lecturing, and there's 20% of the audience are dealing with shockwaves and Peyronie's disease.
It's a big problem.
So I can't even hear the question. So anyway, this is a case where a swimmer was hit by a boat, has a large wound defect, not able to get surgery because diabetes, infection, all this stuff, and the patient got shockwave treatment, and it healed. Even this is the case with an overweight patient with an chronic ulcer, diabetes, necrotic, infected ulcer, with an AV shunt, and all the stuff is done. No better perfusion was able to do. Shockwave treatment was performed, and you can see after 3 months, this severe case has found to be healed within this interval of 3 months, with many months and years of painful ulcers with no options. These data right now, the question.
Sorry, what you cover it with how's the treatment actually done?
How do the technique? Every clinic has certain setup to deal with chronic ulcers or wound diseases. Wet to wet dressings, dry to dry, all this stuff. We don't change the technique the clinics are doing. In my office, we do wet to wet to treat these skin lesions. The patient come in, we clean the wound. We remove the wound dressings, we clean the wound with water, just water, and we put some sterile foil on it, with gel on it, and through that foil we do the treatment. After treatment, removing, cleaning the wound, sterile dressing on it, wet to wet. So we do it once a week. This is our setup. And we're doing 500 shots per square centimeter. So if I have a large defect, so we're treating the whole area.
That takes a long time, right? 500 shots, because if it's a large lesion.
If it's large lesion, it needs time. For sure, it needs time. And what my personal experience is that the border of the ulcer is the region where you can treat most successfully. Right. The growing phase, the closing normally comes from the border down to the center. But we have also cases when we have some cell change, we have skin cells appear in the middle of the ground of the ulcer. Normally they don't appear. Normally we never have appearance of skin in the middle of the ulcer, it just came from the border. We have some cases where we have skin appearance in the middle and the skin closes from the middle also. So this is will be a large indication field for the next years. So it's used in chronic ulcer, in burns, and all this stuff because we know we have a neovascularization, vasculogenic factors. We have all these biomechanical properties. This is a red flap model. Again, this is a rated technique, and you see how we performed it. You see how we performed the flap preparation. The whole skin was dissected, the artery was dissected. Then we did the treatment. One group gets 300 shots with radio technique, and one group gets 600 shots. So, still an animal model. And one group just gets placebo treatment. We did the laser Doppler imaging system, which is a good system to analyze the perfusion of the skin. And you can see in the active group that the blood perfusion, and with regard to ischemic area, the control group is doing worse. So as much shockwave were applied, as better the blood perfusion of the necrotic area is, even in the borderline area. That's the reason why we start the treatment for chronic ulcers at the border of these ulcers. The size of the vital area, it's bigger in the active group, 600 shots with radio technique, 500 shots per square centimeters. And the size with regard to the ischemic area is decreased in the active group with 600 shots, statistically significant in comparison to the 300 shot group and the control group. shrinkage. It's everybody who deals with burns, for example, knows that shrinkage of the scar it's a main issue to deal with. And if the patient got shockwave treatment, the percentage of shrinkage is decreased as well. So healing phase and healing speed is accelerated, and the shrinkage percentage is decreased when they get shockwave treatment. The radio technique is also appropriate to use in chronic ulcers and burns as well if you have skin lesions. This from Wolfgang Schaden is the prospective trials, not placebo-controlled, with all these ulcers because of trauma, surgery, venous disorders, artery perfusion disorders, defibrillated burns and stuff. And he applied 500 shots per square centimeters as well. You see these ulcers, nobody wants to have it. And with the group of burns, for example, 5 cases, all they healed with shockwave treatment. With chronic venous ulcers, they mostly heal by shockwave treatment. And we found in our group that even an affected area is no longer a contraindication. We did a study with microbiological setup using some bacteria stains. We dealt with the special holder. We placed the bacteria in certain water bars area. We put the patient in the focus, we put the bacteria in the focus, apply 4,000 shots with different energy levels, up to 0.96 millijoule per square millimeters. You see these bacteria stains. Everybody who does surgery knows the names precisely, immediately, and nobody wants to have these kinds of stains in your chronic ulcers. That's the outcome. You see the gray lines is the control group, and these lines over down, these are the active group. Even if you have an MRSA, it's very effective. It's a logarithmic scale, so the number of bacteria is significantly decreased in all bacterial stains. There's a relationship between the energy flux density. As high the energy flux density is, as less bacterial concentration is. Also with regard to numbers of impulses, as much numbers were applied, as much bacteria were decreased in numbers. So there might be acoustic threshold. So the bacteria are able to tolerate a certain amount of acoustic energy, and when the energy is reached, they die. Like radiotherapy, you can tolerate only a certain range of radiotherapy, then your cells will die. Shockwave treatment is spasticity. This is called an exceptional indication. We have 2 large neurologist group. They're working with patients have spasticity after stroke. They have congenital spasticity patient with cerebral palsy patients, and they treat the muscular disorder. They're looking for the affected muscles, and they did the radio technique by smoothing techniques, and they found they're doing much more better. And this is an Italian group, just a picture showing how it is doing. This is right before treatment. And if your patient after stroke, they're not able to open the hand, they cannot use the hand anymore for nothing. If the patient is able to open the hand, they can use it as a hand for sure, with a limited range of things they can do. But for the patient, it's dramatically, it's a very significant improvement clinically, even if the scoring system is pretty low. But I have patients also dealing with, I have treated patients with spasticity after stroke. They can open the hands on the affected side. They come in every week or every 4 weeks to get the treatment because it's a huge improvement clinically. This is a prospective controlled trial dealing with this. This is a setup. This is a baseline outcome measurement right before the sham treatment. Then patient got sham treatment. Then they reanalyze the same collective treatment cycle, and then reanalyzing the patient after 4 weeks after treatment. They use a certain setup to make a measurement, how much power they have, how much spasticity they have, and you can see baseline and post-sham treatment, no difference. After the active treatment, right afterwards, up to 4 weeks, the spasticity is clinically much more better. Shockwave in reflex sympathetic dystrophy disorders. It's in perfusion disorder. Everybody who deals with trauma and surgery has seen patient with this reflex sympathetic dystrophy syndrome. Pretty hard to deal with, very painful. And this study is an Italian group from Naples. They have performed shockwave treatment and they found good outcome in this kind of disease, similar to the pillar pain disease. It's a nerve entrapment syndrome as well. Every hand surgeon uses they have night pain, and dealing with shockwave treatment, they're doing much more better after the shockwave treatment. Joint stiffness. We had discussion in the break. They have joint pain after total joint replacement. With this knowledge, I have many of my cases. I do a lot of knee replacements, and my staff, if they come back from the rehab phase after 6 weeks, then they have a restricted range of motion. They're able to, let's say, they have an extension flexion of 90 degrees. They can bend the knee for only 90 degrees. They have soft tissue pain on the collateral ligaments. They get shockwave treatment, and they do much more better. They get pain relief because the overstuffedness of the collateral ligaments, and the range of motion is doing much more better after shockwave treatment. Osgood-Schlatter, we have said it twice today. It's an excellent option. I think it's not an expert indication. It should be indicated in all these pediatric diseases immediately when the patient comes into your office. This is a hard case. This is a congenital non-union of the tibia. Pretty hard to deal with. Even if you do surgery, put nails on it, you put plates and screws on it, they don't have no healing because they have a congenital malperfusion era right here, which leads to the fatigue fracture, finally to a non-union, and pretty hard to deal. In this case, get shockwave treatment, 4,000 shots, put the patient in a cast, and 55 days after, it healed, showing by this CT scan, this complete healed after extracorporeal shockwave therapy. This is a candidate with patella bipartite. I must go back. This is right after treatment. The patella looks pretty good. You see slightly where the bipartite area was. Anterior knee pain for a long period, shockwave treatment, healed. Osteoporotic. I can confirm these findings from the group where Wolfgang Schaden was involved from Austria, and I have confirmed these findings by our bone density measurements in patient getting shockwave treatment because of plantar heel pain when we found the increase of bone mass density. Osteochondritis dissecans. Richard Thiele, he is an orthopedic trauma surgeon in Berlin. He did a case series with osteochondritis dissecans stage 1 and 2 when the dissecans is still in place, not loose. They get shockwave treatment. They found the refixation is found in all these cases and the medial condyle of the femur. Arthritis. This is a very interesting field. There is a Chinese group, this is initial data published by Neuland and Duckstein in Hamburg. They found in better cartilage, biomechanical cartilage properties after shockwave treatment. But the Chinese group, they did an animal trial with rabbits when they resected the ACL. And in the animal model, if you resect the ACL, these animals get an arthritis immediately because they've lost the stability. And the group, they get shockwave treatment, they have an ingrowth, a better concentration or higher density of the subchondral bone stock. They have a better stability of the superlying cartilage layer, so they have less arthritis in the treated group. So these are groups working on cartilage, and arthritis is still starting right now, and you have to keep a focus on it because with the next 1 or 2 years you will find the first clinical data working with shockwave treatment and arthritis of the knee or other localizations. Ischemic heart disease. You have seen the animal picture before where they have had occlusion of the LCX, of the coronary artery, and we have 2 clinical centers worldwide right now. They're treating patients with a chronic artery disease. It's doing better. This is publication right now coming out for different authors. treating patient really with in patient after heart attack or after epicardial myocardial infarct. Published in the JAMA, the Journal of American Medical Association, it's a clinic application of the cardiac application, and did a positive controlled trial with 40 cases, and they're doing much more better when they get extracorporeal shockwave therapy with regard to blood supply on the ischemic area. This is published in the JAMA. You can download it, you can easily find it. And another indication, the blood supply, the peripheral blood supply, peripheral artery disease, it's called claudicatio intermittens, is doing also better if you apply shockwave treatment at the occlusion area where the artery is smaller in diameter. Periodontal disease, just to complete the whole cycle, in dental surgeries they're doing right now for prevention for the periodontal disease. Treatment of the erectile dysfunction, parent disease, it's a large field, it's in urology right now. Interesting to see how they make it, but they have good data. And this is the study from the chronic lymphatic edema. It's published in South Korea, just in 2009 or 10, something like this. And they apply shockwave, 2,000 shots per sessions. You see the low energetic range they applied. Get 1,000 shots at the most fibrotic area, 1,000 shots in the area around, and they did it twice with a 2 weeks interval, 1 week interval, and the outcome showed that they have a good outcome pre and after extracorporeal shockwave. The volume itself and the diameter of the extremities and the lymphatic edema was reduced significantly after extracorporeal shockwave therapy in all these locations. Below axilla, above elbow, below elbow, above wrist. You can see it here. It doesn't look so dramatic, but it was statistically significant in favor for the active group. Low back pain, if you have insertion pathologies on muscle spasticity, and low back pain is doing well. You can use a V-actor system. You can use a radio technique also, but be aware, if you go to the thoracic area, don't use focus devices.